Hi, Mama.
Oh, hi. You could tell me you started.
That's what the Hi Mama was for.
Yeah, okay. Hi, everybody. It's me. Gosh, I'm sorry I haven't picked up on this better, kept up with you all. It just seems, we were doing this typically on Sunday evenings, and lately, I've been really, wiped out by the chemo treatment today. When I first get home, I'm wiped out. I come home, I go to bed for a few hours. But, you know, that first wiped out part wore off, so I'm doing okay right this minute. So, just to keep you updated, I saw the surgeon. They want to do a mastectomy. We're going to take my entire left breast. Probably around the first week of February. I've got a lot of pre-surgery tests to do before I can schedule it. So we're looking at 2 or 3 weeks. Not fun, but I kind of knew it was coming. So I've had a while to wrap my head around the idea. And we'll see how well I handle it when the time comes.
Well, and you're gonna see the reconstructive specialist as well.
Yes.
So
from the people I've spoke to who've had breast cancer and had mastectomies, they say they get a plastic surgeon, reconstructive plastic surgeon involved from the get-go. It was suggested, I mean, I didn't even know anything about this, but my surgeon, who's going to do the mastectomy, suggested that I go and talk to one. Gave me a couple of people to look up, see who I wanted to do in accordance to the hospital I want it done at. And he gave me a couple names, and I finally got an appointment with one of them, which is the one I wanted. She's a woman. David thinks it's probably better for me to have a woman. I don't know. But her credentials are really good, and she sits on the American Cancer Society board. So I figure, she's used to this. So I do have the appointment with her the end of this month. So as soon as I see her, then we figure out what dates are real good for the two of them, because they're both in the operating room. So that's that. Do you know that taking my breast, a mastectomy, because of the world today, is an outpatient? I just thought it was so strange. I mean, they're going to take my breast and send me home. Chop it off, throw it away, send me home. It's just, I guess, because usually it used to be that they'd keep you overnight, but just because of the way the world is, I guess they just want to keep you out of the hospital as much as possible. So we'll see. That I just thought, and that was a morbid joke I just said, but I've got to find a way to laugh at this, or else I'll be in tears. Anyway, so there's that. There was something else.
we got next week's your last chemo treatment.
Oh yeah. Next week is my last chemo treatment. And, I don't have the paper to tell you. But I am going to be, once I have surgery, I'm going to be on that HR positive, HER2 negative medications for the next 10 years. And because it's a form of chemo, I guess we're going to work on this right now, the breast cancer, and and get that taken care of. I still have to go through radiation after my surgery, but because radiation depletes you is so tough on the body, they said that I'm going to have to really heal, not just be able to get up and about after my mastectomy. So we'll see, and I'll keep you posted. I don't know if I'll keep you posted.
Yeah, you're not going to do a live stream from the surgery room, that's for sure.
No, as it is, it's an outpatient procedure, and and David's going to drop me off, and they'll call him when it's time to pick me up. Nobody can be there for me or with me, so that's kind of a daunting feeling. It's, I've gotten used to doing everything else alone, but that one, kind of scary. Either way, you all right?
Yeah, I'm good. I'm good now.
You're just fidgeting.
Well, I had to move my knee was getting stiff.
Okay.
In that position.
All right. So anyway, I just so appreciate you all. And I hate to ask, but I'm really behind the 8 ball here. It's not just the medical bills. David's business seems to be like going out of business, and he works on commission, so he hasn't made any money in a couple months, and that's okay. I could have tried to find a way I can sell something, but then the van broke down, and it's the transmission, and we don't have the money to fix that. And then, do you pay your rent, or do you pay that, or do you pay your phone, or my health insurance, or I just really could use some help. I'll find a way to make it up to you. I will. We'll get through this together with your help. And God, I feel horrible. Like I'm ashamed to ask. I'm working with a social worker to get disability. I had an appointment with her today after treatment. I filed a cancer care. I went to the Komen Foundation, and they're all like, well, we're out of funds. We're out of funds. We're out of funds. So I'm not getting any help. And because I got the cancer diagnosis last year, I forgot to file taxes, so I'm not getting any stimulus help.
At the moment.
At the moment, I can't get unemployment because I didn't file the taxes. I've got a friend, thank God, helping me with the taxes thing, but he's a friend, and he's not charging me, and he's in California, and it's kind of it's tax time, and he's trying to help me with what I've sent him. Of course, I don't have any paperwork for the last year, but all I did was work for, 3 months before all this started, so I don't know. I'm so grateful for your help, and if you could please help a little bit more. Any little bit helps, and at least spread the word. Some people, and I can't think of their names, were so sweet. I saw that they reposted the GoFundMe thing, and it was so sweet. I wish I was in LA. I'd have my people around me. I know y'all would visit me. I can't leave the house, so I'm clean. I can't get out in public. It's just too scary. It's hard enough just to make it to the doctor appointments and the tests and and the chemo and everything, so I'm sorry. It doesn't matter how I feel. Thank you. Thank you for all your prayers and your well wishes. Those help me. I'm getting to that point now where it's getting to me emotionally. And what are you going to do? You just got to keep trudging along. I'm going to make it through this. I just think I'm tired. And it's getting scary because the surgery's coming and I got to go alone. But I love you all. And I know you're with me. I know you're praying for me and you're sending me love. And that means a lot to me. It really does help me. I'm not good at posting. I just don't know what to post. And I don't know how to do that Facebook video where you just sit there and talk for a minute and post it. I don't know how to do that. And I don't know how to reach out to people. And I've never done a Zoom. I just don't know how to.
Well, I'll show you how to do the live stuff.
I don't know
That's
how
easy.
to do any of those things.
I'll show you how to do the live stuff.
And I'm trying to get used to this. At least for now. But now, they're hitting me up with the medications, and now you're going to be on that for 10 years, and I got to get bone shots for my bones, and I don't know. It's just kind of getting to me. It's 5 months now, you know what I'm saying, that I've been in treatment, and the month before with all of it, it's sneaking up on me when I don't even know it, But it's okay. I love you guys, and I thank you. Thank you.